It is time for your health beat. A Sacramento pharmacy is doing what it can to get rid of the Mpox virus. Now, you may remember that virus went by Monkeypox, but now health organizations have agreed to refer to it as Mpox to move away from the stigma that comes along with the animal attached to its name. It's most prevalent among men who are in relationships with other men, people who are transgender and their partners, also women who are in relationships with bisexual men. So if you take a look at Sacramento County's Mpox dashboard, you'll see the new numbers of cases have gone way down. The county has seen a total of 141 cases without a new one since October 2nd. And Pucci's Pharmacy is working with Sacramento County Public Health and community-based organizations to hold pop-up Mpox vaccine clinics for those who are still at risk. But it's running into a problem. Take a look.
So far, Pucci's Pharmacy's effort to get rid of Mpox is all charity. Owner Clint Hopkins says unlike for the COVID vaccine, there's no general Mpox fund for the and underinsured. The federal government provides the vaccine for free, then typically health insurance covers the administration costs.
We've only been paid actually for one vaccine. One claim went through Medicare. The rest of the claims through the commercial payers, none of them have paid so far. None of them are acknowledging.
Which means Pucci's is footing the bill.
The time we spend with the patient counseling, the actual administration of it, that takes a skilled person that we have to pay, and we should be reimbursed to pay that person.
It's something Hopkins says isn't sustainable long term, but it's an effort that will continue.
The curve has basically gone to nothing, to flat. It's very important because if we didn't do that, if we weren't providing it, we would have more cases of infection in Sacramento County, in California. And some of those cases can be severe. It can leave scars. It can be disfiguring. People have actually died.
Even though severe cases make up about 1%, ABC 10 health expert Dr. Pyle Coley says those who aren't vaccinated should still get one.
It's not just to protect you, which it obviously does very efficiently, but it's also to kind of prevent the fight against the infection overall. So the more infections that happen, the more the virus has a chance to mutate and the more potential that you might have for vaccine resistance occurring down the line. So we're not out of the woods yet.
And Pucci's Pharmacy has another clinic this weekend. It's October 29th in South Sacramento at the Marsha P. Johnson Center. The information is on your screen. If you cannot make it here, Hopkins says there is open appointments at the pharmacy that go unfilled every single day. So they're really trying to appeal to those who are hesitant, those who didn't think they needed it, or maybe you recently fit under that at-risk category.
It's interesting you bring up Mpox and how many of those shots he's having to foot the bill for, but people who are also going around looking for pneumonia and shingles vaccines are running into the same thing in terms of insurance.
Yep.
So maybe Mr. Hopkins can solve that quandary.
He wants to see that fund started, so there's baby steps. Got to start with one, and then maybe we can get more.
That's right. Good health beat. Thank you, Bree.